thank you for being with us here. This is a very pertinent part of this conference, and I think of the entire gamut of affairs of how hospitals work, especially today. I think most of us are from the business side of the hospitals. How many clinicians are there in the house? Clinicians, yeah. I think you also must be under a lot of pressure on the kind of supply chain, the formulary, the implants, etc. that you use. So this has become a very important part of the P&L also. It is also what drives the EBITDA. It is what drives the profitability of the hospital structure. And unless we have a sizable component under the line, which is the bottom line, we cannot think of expanding our hospitals. We cannot think of buying better equipment. And we can definitely not think of reaching out to greater communities than we do today. So which is why supply chain becomes very, very important, and the people behind the supply chain are very important because they are the intellectual property really who are trying to build a robust system where not only is the business side taken care of, but the clinicians' work also should not be affected. So I have a very interesting panel here with me. Dr. Venkat. Dr. Venkat is the Director and Chief Procurement Officer, Supply Chain from Max Healthcare. A very warm welcome to you. Asha. Asha is the Head Supply Chain Management from Dharamshila Narayana Superspeciality Hospital in Delhi. Vikas. Vikas Goyal is the Head of Procurement and Supply Chain from Fortis. Pradeep Mishra. Pradeep is Associate Vice President, Central Procurement and Supply Chain, Paras Healthcare. And to my right, Rashmi. She is a Vice President, Procurement, Birla Healthcare Private Limited, and I'm from Jaipur. We run a chain of super specialty hospitals in Rajasthan by the name of Apex. So thank you very much. And traditionally speaking, whenever we get together, I think the first thing that we all like to discuss is what are the challenges we are facing today? So I think that is going to be my first question. What are the primary challenges faced in strategic sourcing and supplier management within the healthcare procurement landscape? And I would put up this question to all of you because I think you all will have some commonalities and some very unique views into how you view your procurement systems. So let's start with you first. Vikas.
Good afternoon all. Vikas this side. So we see why the supply chain is important. So if we see in a healthcare, about 35% revenue cost is going in the supply chain management. That's why it's one of the important part of the hospital, how to spend judicially the money which the patients are providing to the hospitals for the better patient care. Now we see the challenges in the supply chain we face. First is a manual method. So in a supply chain, there's a manual traditional methods of manual PR, PO, GRNs, etc. Demand forecasting is manual. So that is one of the challenge which gives non-visibility to the management to take a real-time solution, real-time stock situations and take the decision on that part. Second is the individually buying. So every hospital try to buy individually. They are not going for the group procurement or they are not strategizing or centralizing their procurement. That's why they are losing their margins. They are losing their negotiations capacity with the suppliers over there. Third is quality issues. Now we see in India, there is so many suppliers, the regulations are so weak or they bypass the government regulations and make the products for the hospitals. So to choose the right product for the hospitals and to maintain the continuity of the quality of the materials, that is one of the biggest challenge in the supply chain over there. And fourth is a margin. So every hospital is looking for the margin and they want to improve because this is one of the areas which earns the money for the hospitals. So these are the four challenges which we are facing in the supply chain and try to find out the solutions on an optimum level.
Thank you so much.
Good afternoon, Venkatesan. I wanted to say something before starting the answering her question. This is post-lunch session. एक कहावत है कि खाने से पहले सुन नहीं सकते हैं, खाने के बाद भी नहीं सुन सकते हैं. So let's start with the challenges in healthcare is huge. Like my colleague Vikas has covered most of the thing. Globally, the cost has been increased. All medical and consumables, all the equipments, cost has been increased drastically. Particularly post-COVID, the supply chain cost has been increased 15 to 20%. So this is a big burden for the healthcare to maintain the cost. So this always, the burden comes to the patient. They have to pay more to get the treatment. The second thing is IT cost has been increased. As you all are from the IT companies, I request you also have to consider the price increase. Every year the price increase, I'm seeing that 15 to 20%. So we as a Max group, we always spend more than 10 crores on IT products. This is except the hardware part. On the IT, like mail security or cloud server, storage, all the other IT products, we are spending huge money. Apart from this cost only, is a huge attrition in healthcare. We are not getting a right people, qualified people. A huge attrition in healthcare. We are not getting a right nurse, or in supply chain also right people who knows all technical terms in the supply chain points. So these are all the challenges what we are facing right now. So I'll give it to Asha for the remaining points.
Good afternoon, everyone. So in healthcare, the main challenge is, as you know, supply chain is such a vast data, and we have that database for the analysis. So the vast database analysis is the main challenge, because that only helps in the predictions, forecasting and everything. Then balancing quality care and cost optimization. As everyone is saying, cost is the most important factor to run a hospital or a healthcare, for the healthcare business as well as for the patient care. The quality variability, the product, the patient outcomes, involvement of the doctors, because when we plan for a formulary, there are a lot of brands coming up nowadays. So to ensure that we take the good product quality with a cost, with no compromise on the quality of the product, because a better outcome, better product will only give the better healthcare to the patient. So, however, amidst these challenges, the opportunities also lies within that we have already worked on, and a lot of healthcare institutes with the digitization and all this, we have overcome all these challenges. So these are the main challenges which we think that we need to work on. Thank you.
Good afternoon, everyone. This is Pradeep. So the challenges, before coming into the challenges, I would like to add that supply chain or the procurement adds a majority of the contribution in hospital revenue. I mean, this is somewhere up to 40% in some hospitals, and 35 to 40% is their top line. The contribution of the supply chain is there in the top line of any hospital, whether it is a standalone hospital or it is a group of hospitals. And if I talk about cost, then the cost remains between 22 to 25, 26%. So it depends on what specialty your hospital is at, what kind of channel your hospital is using. Coming up to the challenges, so I will break the supply chain into different verticals. The supply chain can be bifurcated into verticals like pharma, medical consumables, implants and non-medical. In pharma, the challenges are that there are n number of companies wherein you can choose your generics, generic items. The challenge remains about quality. Though you have to maintain the cost of for the organization, but you also have to maintain the quality. So these are the two things wherein you have to ensure that you provide the best cost for your organization and the best quality product also. So there is a challenge wherein somewhere you have to choose between research molecule and generics or branded generics. In medical consumables, definitely, and implants. These are the two verticals wherein this is, if you have multiple locations, implants is still a distributor-driven model. So there is a area, or maybe there are certain areas wherein doctors are more involved with some distributors. There is a separate companies which is working in different areas. So this is a challenge wherein you have to optimize, or you have to consolidate the complete SKUs which are being used across your hospitals. This is a challenge because now you have to move from distribution-driven business to manufacturer-driven business, wherein you have to directly do your rate contract with your manufacturers. So these are the challenges, but since this is a more digital-related conference, so with the use of digital, I think digital and AI, we are able to manage most of the challenges.
So I'm Rashmi. I would like to kind of summarize what my fellow colleagues shared. In terms of challenges of healthcare, I would say the challenges are there and they're very different because of the kind of services we are offering. We are actually serving people in saving their lives. So if you summarize what my colleagues talked about, the challenges are related to doctors when we have to convince them in terms of what is cost-effective service and that needs to be taken. So supply chain as a function is the backbone of the entire hospital. We work together collaboratively with our internal stakeholders to ensure that the best service is provided at the least cost. And the challenges that have been mentioned by the team are being consolidated in a manner that we solve them to serve our customers. So that's how we look at it. If there are any questions, we are happy to answer. Though healthcare as a field is very, very vast, but we'll be happy to answer any questions if there.
So thanks, Rashmi. And moving forward, while you still deliberate on the questions and maybe they can be strung together with the new questions that I ask. So we have enumerated our challenges, and there are so many other challenges also. If you just drive down to the micro nitty-gritties, the non-movings of the world, near expiries of the world, the pilferages, the problems with barcoding. There's so many things when you actually come down to the execution part. So these are the broad macros, and then there are the actual on-ground issues. Now, we have come a very, very long way from the way we used to procure earlier. There was manual procurement, and there used to be calls made on the phone. But now we have so many HIS, and like you rightly said, we are sitting on the digital platform. There's so many softwares. I think we will have to move to the digital transformation in every organization, and especially for supply chain. It is not just for making procurement better, but it's also for providing a futuristic solution to what we can procure in a better way in the future. So having said that, what do you think are the key factors to consider if we were to move from the traditional to the digital procurement? All of us are doing that. But with your experience, what do you think have been the key factors which we should take care of? Very specific. So I'm going to put up this question to Asha, Vikas, and Pradeep in any order that you wish to answer in.
Yeah, as we know that traditionally the supply chain executives have struggled a lot. And we all sitting here, we are the generation, we have seen the traditional way of working and we have seen the AI generation also. So the key factors which we think the cost and return on investment, when we are investing on the digital apps, on the IT, we have to analyze it, and based on that, then we have to integrate into the new technology. The supplier relationship is the most important part of the supply chain. So with integration, with meetings with the vendor and taking them into the consideration, we can automate the processes, we can simplify the analysis, data security. Robust data security is the most key factor in supply chain, because we have such a vast data and the prices can be easily shared in the competition, though the industry has most of the prices fixed, but coming up with those new guidelines, every hospital, the data sharing is the key factor, and that's security is the most important thing. Validation of the database and the regulatory compliances are also most important for the supply chain team. The most important is the training and support of the key team members, because the team has to be continuously trained on the adopting the new technologies, looking at the new data. The skill set has to be improved. So that training of any software is the most important part when we can automate and digitize all these processes.
So friends, in a supply chain, if you'll see, the three things are moving simultaneously. One is flow of information, flow of material, and flow of financing. The flow of material from the patient prescriptions to the patient, if in a medical term, and in the non-medical for the self-consumption for the hospital. Flow of financings, again from the patient to the hospital, hospital to the employees, employees to the government, government to our maintaining our livelihood. There's a flow of money. And flow of information from the manufacturers to the wholesaler, wholesaler to retailer, retailer to hospital, and hospitals within the hospitals. So many teams over there. So healthcare is a social matrix organizations. A lot of people are working together to provide the healthcare. There's doctor, clinicians, pharmacists, nurses, stores, center stores, etc. So what the solution we look forward in the software, we have to integrate all these three things. That is flow of information, flow of money, and flow of material. And we look forward for the solutions in the softwares or ERP packages like e-tendering, e-procurement, e-sourcing, e-inventory management, and e-information storing in the systems over there. If we have these 5 things in the software, I think that sort out a lot of problems and challenges in the supply chain management.
Thanks, Vikas. So the question is, what are the key factors while transitioning from traditional procurement or supply chain management to digitization of the supply chain management? So it's not that we were not using the IT for our procurement, but the use of analytical tools and software has been increased with the focus on improving your COGS and improving the margins, and there is pressure on EBITDA or for all the hospital chains. So the supply chain process can be broken into, like inventory management, consumption, and then your COGS analysis. So the digital part of the supply chain, wherein you use either software, which is HIS, or some BI tool, which helps you to analyze your inventory, whether the stock is non-moving or it is going to expire, which supplier is, you have to return back the stock to those particular suppliers. So these kind of analysis you can do with the click of a button using the your software or HIS. That is your inventory management. You can also understand what are the stock values across my different stores, across my different locations or across my different categories. That has become very easy. So this is one of the key factor, right? Wherein you can see on a single screen what is my stock status, what is my non-moving stock, what is my expired stock, or what is the stock which is going to expire. That is inventory management. Now coming to consumption. There are 2 types of consumption. One is the consumption which is patient-centric consumption. One is the consumption which is departmental-centric consumption. The patient-centric consumption is the majority of your consumption which takes place. But earlier, what used to be done? We used to get an indent, we used to issue, that's it. But now, with the use of these tools of HIS, you can see your movement of consumption, which specialty, which doctor is doing what kind of consumption, which store is doing what kind of patient-centric consumption, what is the COGS of that particular specialty, like whether your COGS of maybe your ortho specialty would be high, but COGS of your internal medicine and ICU would be low because they don't use that kind of implants and all. So these kind of information you get by using your software and all. So coming back to the question, the key factors which you have to consider while moving from traditional supply chain managing system to digital supply chain management system is that you should have that efficiency which helps you to control your inventory, consumption and COGS, which definitely is going to help improve your EBITDA.
Thanks. So in the interest of time, I'll pivot the questions a little bit. If I were to ask all of you, and I'm going to start with Rashmi first, go to Venkat, and then the 3 of you. You know, as a head, and you're all supply chain veterans, you're the heads, and there is a management requirement of putting as much as you can to the EBITDA, but taking the interest of the organization in quality and supplying the right kind of product. What are the top 3 metrics you would look at, considering that maybe you have a great software or you have AI-powered analytics for your software? What are the top 3 metrics you would look at to ensure that you're doing the right ethical but cost-effective thing? Rashmi, would you like to go first? And this is especially in the interest of our audience. If they want to have a very clear takeaway, then I think this would facilitate it.
So thank you for this question. And I would say, looking at how healthcare industry operates, and if you understand a healthcare a bit, there are a lot of people who are very old in the system. And when these people have to transition to a system in terms of a IT, HIS, ERP, or an integrated end-to-end system, the most important thing for the doctors, for the supply chain professionals, is the ease of use of the system that is being brought on the table. So if there is a team member in my team who is working in my hospital since 15 years on a manual process of a purchase requisition, purchase order, GRN and everything, and on one day I ask that person, now, hey, you have to use this software and this is how it operates. If the GUI of that software is complicated, the adoption will be very, very less. So it is very, very important for us as leadership that when we are evaluating these softwares, we evaluate it from a user interface perspective. My team members do not need to toggle a lot into multiple screens, do not need to toggle about multiple applications, and they should be able to use it efficiently. That's the first thing that we would look for. Second thing, as my colleagues mentioned in earlier discussion, it is very important that the HIS should offer us those analytics that help supply chain professionals to understand what are the key parameters to be focused upon. So maybe a spend analysis on a click of button where I can talk about 3 months purchase, do a slicing of the entire data in a very easy manner, and I can categorize, okay, so these are the top 3 items I have to focus on as a supply chain professional. I do RFQ and I finish the negotiations. You must know, from a healthcare supply chain standpoint, I would say it is the most complex industry to deal with when it comes to procurement and supply chain as a whole thing. So procurement is actually a part of supply chain, then comes the store bit, then comes the inventory, which directly impacts the cash flows of the organization. So it is very, very important that the tool that is being offered, and we as leaders are finalizing for the organization, offers us those data points as a very smart way, which can give direction to our team members to start working on this. So these are the 2 things I would say are top priority. And last but not least, most important is the ROI, that if I'm making investments, how much I am saving as an organization, what are the artificial intelligence inputs that can come in the software that will help us to do the efficient procurement. Yeah. So I will quickly pass it on to Venkatesan.
Yeah, the system should be easy to adopt. Like, for example, we have implemented the e-prescription in our hospital. Doctors are not ready to, type the item name or prescribing the drugs. So it was very difficult to convince them to use the computer system because they were used to write fast in the paper and give it to the patients. That's what, the conversation happened, in last 2 years back. When we give a computer system, we told the doctors to give a prescription, typing and select the product and give the prescription or complete computerized prescription. It's very difficult to, convince them to adopt this. So whatever system, whatever software, whatever IT systems we are providing, it should be easy to adopt. The people should, use it very fast, and they should think that it is good for the organization. Number 1, and also it should be cost effective, and it should be affordable. So there are many tools which is available, which is very costly, which the small organizations or small hospitals cannot afford. The big corporate hospitals, obviously they are buying, but the small group of companies can't afford that because it's very high priced systems. Like medical equipments, which are all coming through AI-based system. Nowadays, the linear accelerator also coming with the AI-based tool. So while our heart or lung moving, when moving only, the radiation treatment can happen. This is only because of AI, artificial intelligence development, and integrated with the medical equipment and the softwares, applications. Usually, in a hospital, we used to have 6 to 7 applications, HIS application, risk packs. Risk packs is some, archival of picture, like storage of your X-ray, CT scan, all this. Risk pack systems and accounts payable system, ERP, inventory management, or the module. There are 6 to 7 systems normally used in a hospital, but all are integrated. So nowadays, all the medical equipments comes with the HL7 compatibility, and they directly integrated with the HIS system. So once we put the blood inside in the diagnostic machine, reports comes into the HIS. That kind of developments are there, but still, according to India's development, it is very costly for the small and medium level of companies. Thank you.
So thank you so much, Venkat. And we did hear from the other 3 panelists on the software. So is it okay if I jump to the next question, which I would like to, and that would be the last question of the day. And we'd love to take a few questions if time permits. So basically, why are we here? Why is supply chain even here? So we are not a standalone vertical. We can do nothing. We're basically a bridge between what the patient needs and what the clinician prescribes, right? We are simply that bridge. We've got to be there to make this transition and this transactional activity between the two of them very, very easy in real time. So what are the collaborative efforts that you think should be done between the supply chain management and the clinical teams? That is really the crux of why all of us are here. So I'll start with Vikas, and then all of you must take this question, please.
So as I already said, hospital and healthcare is a social matrix organizations. So from a super specialty, physicians or surgeons till the security guard and GDs are working in the hospitals, and they have to collaborate with each other to provide the complete, efficient and effective patient care to the patients. So for that, we think from the supply chain point of view, 3 things are very important. That is quality, cost and availability. So we think quality has to be visible to the top management, and very important for the patients, doctors and physicians for the hospital. What the material they are ordered, what the material the hospital is procuring, what we are providing to the patient, that all contributed for the patient care, early patient care and early recovery of the patient. Second is the cost. Cost is also very important for the patient because they require the affordable cost. Management look for the margins, so they require the material should be purchased by the hospital at the least cost. The insurance companies also want to reimburse the bill, so they also want to keep the cost very curtailed. So there should be minimum cost occurring in the healthcare providers over there. So cost is very important for all the stakeholders who are getting the treatment, who are providing the treatment, who are reimbursing the treatment. And third is the availability. So supply chain is a chain where the demand forecasting till the consumption, so many people, so many authorities, so many layers are working together. So availability of the material inside the hospitals, availability at the manufacturer sites, availability in the transportation and in between the transportation to the hospital to the manufacturer is to be visible in the software and to be available on a real-time basis to take a effective decision by the management.
And I think I'll just like to say this before we go to Venkat, that we were, I think, tested with our capabilities. We were really tested during the COVID times, right? We had to make so many things available at God knows what for God forbidden cost, and they just had to be there. And then we had to manage that inventory and still keep the costs in control. Over to you, Venkat.
Yeah, the number one is, patient satisfaction. Before seeing the cost and other, things available, make the available material available on time. So there, at a time, midnight, 2 o'clock, we get a call for the drugs or some implants when the patient is serious and the operation is going on in the midnight. So as a supply chain, we always awake. And you all are aware that during the COVID, you rightly said, so all, oxygen availability and your, all the drugs availability was very crucial. Supply chain management worked a day-night, 24/7 and made it available. And we all, proud to be part of the healthcare system during this time and saved many of the life. And normally, patient satisfaction is important in a hospital. At the same time, our internal customers are doctors and the nurses, and we have to provide the right material on right time. so that doctors can treat the patient, with the high quality or high standard. On nurse also comfortably use the consumables without any hindrance. I think if we take care of these things, our patient will go with the satisfaction. Thank you.
As per my thought, the collaboration supply chain is the pillar of the hospital, because we are dealing with all the internal customers, we are dealing with the finance, we are dealing with the nursing, then we have to collaborate with the doctors. The patient is the most important thing to get the best quality care, because the quality of medicine which we are providing, that has to be ensured. That also depends on the hospital revenue, patient stay. Everything is linked to the consumables and the drugs which we give in the hospital. So as a whole, when we see the hospital operations, supply chain is collaborating with each and every department. Not any department in the hospital can be missed through the supply chain. So right doses, right time, right availability at the best cost without compromising the quality, that is the core of a supply chain team.
So the question is regarding collaboration between supply chain and the clinicians. So what does a clinician want from supply chain? He wants that his patient should get the right medication which he has prescribed at the right time, and the technologies which he want to use onto his patients, that should be available with the hospital. So that is what a clinician wants from a supply chain. I would like to add that with the help of digitization, we can also improve this collaboration. How can we improve the collaboration? There may be, I don't know whether some softwares are doing this or not, but there may be some alerts wherein the doctors can get information whether his patient has got the right doses on right time or not, because this is not present there. He needs to be dependent on nurses to ask whether they have provided the doses to their patient. So if these kind of alerts can be made, the doctor would be happy that, yeah, my patient is getting my medication on time. So it is a whole system wherein nurses, clinicians, and supply chains are involved. The major role is about the availability of the right item. Yeah, but maybe there may be some issues wherein the doctor may ask for some A brand, but due to the cost sensitive issue, the supply chain would recommend the B brand. That can be, that is an ongoing process, and I don't think there is an answer of that question. Nobody can answer that question. But yes, availability of the right thing, right technology, right drug, and administration of those requirements, if we are fulfilling on a right time, that would be the best collaborative approach.
So I would summarize it in a manner that in place of considering doctors as your customer, make them your partners. So if doctor is your partner, collaborate with you, and doctor acknowledges that you are working to get the outcomes which doctor needs in the service of the patient, everything is doable. So that's a collaborative approach, and looking at the time, I will quickly hand it over to Dr.
Thank you, Rashmi. So, questions, anybody? Yes, please. The first one to raise their hand was a gentleman with spectacles. Do introduce yourself, just one line, and then please go ahead with the question. Excuse me, I think you need a mic. And we have just a minute, so I think we have maximum of 3 questions or 2 questions only.
Good afternoon. My name is Sharad Raina. One question, just a thought process. We talked a lot about cost, inventories, care for good. How you inbuild sustainability into the sourcing activities? When I talk about sustainability, it is ESG, which is a futuristic thing. So how you are going to do it? Because in future, reducing the carbon footprints is very, very important. even for supply chain for hospitals. If you look at the data, the hospitals are emitting a lot of carbon. So this is anyone who can answer this question. I mean, can advise us.
Who would like to take up this question?
So you rightly pointed out, ESG is the hot topic in the industry right now, in healthcare particularly. So we have appointed the ENY or Deloitte kind of companies. My colleague will agree to that. We all are monitoring the sustainability, procurement, also the environmental, social governance. We are checking ourselves. We are abide the rules. Also, we are checking our suppliers and manufacturers. Are they following these sustainable practices? So the criteria should be met. So last year we have added in our vendor enrollment program. So we have added so many criterias like kind of solar power or some waste, how is, they are doing waste disposal, child labor act, or all the other criteria of sustainable sourcing has been included in our vendor contract agreement. So we all are serious on that, and we are taking it on serious note. And not only supply chain, it is by the organization's goal. We have to submit a score to the government every year. So we all are aware, and we are on track onto it.
And I think
request is that to all the other supplier and manufacturer also to follow that, because we as a supply chain, we are procuring the material from some XYZ, maybe a supplier or the manufacturer. But they also should feel their responsibility, and they also follow the criteria what government has given that. It will be a great help for us as a procurement guy. So if all the supplier, all the manufacturer follows that, then I'll be 90% compliance. And obviously hospitals all do follow the carbon footprint and green energy, all the things we are also following. Thank you.
Yeah, it's a very pertinent question. Thanks for that. I think all of us are following this and submitting this cause. It's a part of our corporate governance. Can we take one last question, please?
Yeah, we can take two more questions. We have.
Yeah. Yeah. Can I? Okay.
You and then the gentleman there, because I think he raised his hand earlier also, and that's it. Yes, please.
Okay. So I'll be very quick. So 3-4 points have come up: the revenue, the quality, the demand, and the clinician's prescription and clientele satisfaction. Now, I do find that in big hospitals, there is a lot of hesitancy in buying the generic medicines prescribed by the government of India. We are still going too much on the branded products. The difference of pricing is a very significant one. So now you are the best person to actually analyze it. Even antibiotics, third generation antibiotics, even certain cancer drugs are all available on the generic market. Now, why is this hesitancy? Secondly, what is your experience? And in case you are still buying a lot of branded products, do you not actually think that the government supplied medicines are of a good quality?
I think none of us is keen on buying branded products. In fact, this is a question that we have to raise with the clinicians every now and then. So I think we are on the same side of the table. But I would like any one person please to pick up this question for answering specifically.
So I think there are certain molecules wherein you don't have generics available, like for immunotherapy items, you don't have Indian generics. The patented molecules, you have Indian generics. But there are certain molecules wherein you have Indian generics available from the biggest of companies which are operating out of India, like Cipla, Dr. Reddy's and all. So, Sheenu rightly said this question should be answered by a doctor, why the preference is there for a research molecule when we have such large companies which are manufacturing branded generics and generics in India also. But yes, the excuse wherein we don't have any alternative, we have to go to those patented molecules. But yes, to provide sustenance to our organizations and to improve the COGS, we have to choose the company which gives us a price sensitive, better price, but not compromising with the quality. So we also see what kind of accreditation the company has, which is the manufacturer of that particular brand. So these kind of things are taken care before choosing a brand which would there be included in your formulary.
Yeah. Thank you. We will have to go to the next question, please. Sorry, in the interest of time. Okay.
So we have both generic and branded. So there are patient comes and ask branded only. So we are not giving the branded, but they Google it, they will come and ask, I want the Zydus product or I want the Roche product. So we have to give, what patient is asking. So you asked generic we are also having it, and branded also having it. It depends what kind of patients or what, doctor is having the confidence in that company manufacturing process and what is the treatment, what they have seen on the patient development. So based on that, doctor prescribe and we as a hospital, we give the medicines.
Yeah, and this choice is mostly for the outpatient, right? For the inpatient, the patient cannot decide. And in fact, for example, I would just like to add, we have about 60% is a generic portion of our IPD formulary. So thank you very much. And we'll move on to the gentleman there for the last question.
Yeah, my name is Anit Lekhrajani. I just wanted to understand from the group here is, as the pharma industry is consolidating and the hospitals also consolidating, unfortunately, the supply chain and distribution is not consolidated as of now. What you all mentioned is looking at the welfare of the patients, the profitability. What are the challenges you all are facing at the supply chain? Especially like all the hospitals are moving into tier 2 and rural cities. So do you have any challenges that you all face in the supply chain of the products or the instruments and other things in the supply chain?
So if we see from the supply chain challenges in the tier 2 and tier 3 cities is a distribution network. So if we see in Delhi NCR or metropolitans, so every distributors, every wholesalers, manufacturers have their tie-ups and have their supplies network, and they can supply within 24 hours, 48 hours time limit also. But if we move from the Delhi NCR or to the remote areas or Delhi 2 and Delhi 3, the distribution network is not so strong. Secondly, now there are so many consolidators and aggregators are coming over there, having a national presence, setting up their distributions network in all across the major areas of the hospitals and try to cover all the government and private hospitals. So I think to the change which is coming in the supply chain network for coming up the aggregators and the distributors on a consolidated basis, that can sort out the problem of the availability and reducing the lead time of the supplies also over there. And secondly, before the question went over there, the last gentleman have asked over there. So in the hospitals, we have 3 types of medications. One is the innovator, second is a branded generic, and third is a generic. To select the medicines for the hospital is depend upon the technical committee of the hospitals, that is the drug formulary committee, who decides based on the standard treatment protocols, the cost-effective analysis of the hospital, cost-benefit analysis of the hospitals. So many analysis they will done before selecting the medications for their inpatients and outpatients. Secondly, to bridge the gap of the cost for the various manufacturing of these medications, the NPPA and DPCO is also working over there, and on a periodically basis, they are releasing the national list of essential medications and the drug price control order to curtail the prices or the inflated prices by some of the companies and to make the benchmark prices across the industries.
Thank you. That was very well answered. And I think you summed up the whole situation very, very well. Thank you very much. Thank you, everybody, for patiently listening to us. And if there are more questions, we can always take them offline off the stage. Thank you.